This video provides information and strategies to help you communicate effectively with people with disabilities. It's usually better to focus on abilities rather than disabilities, but it's very important to know what a disability is and how to help patients with disabilities get the best health care possible. My name is Mike Honig, and I'm blind. I've been blind since birth from Leber's congenital amaurosis, and I've learned to make my blindness just one small part of who I am. I've figured out the best ways for me to learn, work, communicate, enjoy life, and just be myself. I'm an active community member who enjoys many hobbies and interests. Some of those hobbies and interests are travel, gardening, traditional jazz, sports, and cooking. I've also learned what works and what doesn't work for me in healthcare settings. The objectives of this training are for you to recognize what a disability is, recognize the prevalence of disabilities and health disparities, learn strategies for communicating with people with disabilities, including active listening and teach back, and communicate more effectively with all patients. In this video, I will introduce you to several other people with disabilities. Each person will tell you a little about who they are and help you to build the skills you need to provide the best possible health care for patients with disabilities.
Hi, I'm Angie Plager. I'm a quadriplegic due to a spinal cord injury as a result of a car accident at the age of 20. I love volunteering and being an advocate. I'm currently the president for the Spinal Cord Injury Association of Iowa. I also love spending time with my family and friends. I like to do some events that give me a little bit of an adrenaline rush, like deer hunting, paragliding, water skiing, just to name a few. No matter what I'm doing or where I am, having high quality healthcare is very important to me. It helps me continue my desired lifestyle of being very active and helping others and being out and about in the world.
Hi, my name is Sally Green. I had an asphyxiation at birth, and I was diagnosed with cerebral palsy at around age 3. I've also had dysphagia since birth, and I eat with a feeding tube. I have a sensory neural hearing loss and vision challenges from the lack of oxygen. When I was 13, I was diagnosed with obsessive compulsive disorders, nonverbal learning disorder, and anxiety. I've had a lot of interaction with the healthcare system, and as you can imagine, my disability has played a big part in that. I'm an Eagle Scout. I like to ski, and I'm very active in my community. And I just recently graduated from the University of Northern Iowa.
My name is Abby Almoline Bond, and I have a hidden disability. This disability is cancer, and my personal story began when I was only 3.5 years old. After successful treatment, I was able to live free of cancer or any disability for 25 years. Most recently, it has come back in the year 2008. This disability affects me intermittently. So at this time in my life, I still am able to volunteer, be active in the community, and do fundraising things for amputee camp and also various cancer causes. I really, before my amputation of my leg and hip, I was able to do a lot of outdoor things like camping and hiking. Recently, I've been on a cancer camp for kayaking, and I loved it because it really reminded me of being outdoors and camping and hiking once again.
Hello, my name is Sylvia Townsend. I grew up in Iowa, and I'm a student at the University of Iowa. I love hanging out with my friends, cooking for my fiance, and skateboarding. I was born able to hear. At the age of 3, I experienced an illness that left me profoundly deaf. I have worn hearing aids ever since, but need to read lips and use sign language to make sure I understand everything that's said to me.
As you can see, disabilities affect people in different ways and can occur at any time in life. According to the ADA, the Americans with Disabilities Act of 1990, a disability is any long-term mental or physical impairment that substantially limits one or more major life activities, such as a person's ability to walk, speak clearly, breathe, see, hear, or learn. A disability can have a mild to a profound effect on someone's life. Many people don't realize that more than 50 million Americans have some type of disability. That's about 1 out of every 5. As you might expect, disabilities increase as people get older. Less than 10% of children under 15 years old have a serious disability, but nearly 75% of people over 80 have a disability. Unfortunately, over 40% of persons with disabilities report that their health is no better than fair or poor, while that's true of less than 10% of people without a disability. Persons with disabilities are also much more likely to be overweight, to not be physically active, to get fewer preventive health screenings, and to put off getting health care or medications because of the cost of care. It is extremely important for you to recognize that being healthy is still a realistic goal for people with disabilities. Healthcare providers can have a major impact on people's lives by helping to prevent disabilities and by making sure that complications from medical conditions are detected quickly and treated effectively. We're going to demonstrate and discuss situations that involve individuals with disabilities interacting with their healthcare providers. You may notice some common mistakes the health provider makes before demonstrating a more effective way to interact. Though some of these mistakes may seem avoidable if common sense were used, they are based on real-life experiences of individuals with disabilities, such as those you will see in this video. In this first demonstration, Angie will show how important it is to greet patients with disabilities by speaking to them directly.
Hi, I'm Ann. I'm Dr. Johnson's nurse today, and you are?
I'm Peter Wilson. I'm Angie's personal assistant.
Well, great. Peter, could you tell me why Angie came in for a visit today?
Angie just asked me to drive. Angie would know more about the reason for her visit.
Oh, hi, Angie. Could you tell me what we can do to help you today?
Sure, I'd be happy to, but can we first move so that you can sit eye level with me so I'm not straining my neck to try to talk to you?
Sure. If you move over closer to the desk, I can sit in the chair and take notes while we talk.
Okay.
And before we begin, since you brought Peter, your personal assistant, with you, I need to know, do you want him to stay in the room during your health history and exam, or do you want him to wait in the waiting room?
I think he can wait in the waiting room during the health history, and then he can also be a help to transfer me to the exam table, so then he can come back for the transfer. As you can see from the demonstration, some important points to take note of are to communicate directly with the patient and not the personal assistant or the person with them. Ask if the patient would like their family member or personal assistant to remain in the room or into the waiting room. Healthcare providers should be at eye level with the person with a disability and not above or behind them. Respect the patient's personal space. Do not lean on their wheelchair or put things on their handles without asking permission first. If people do not look at me or speak to me directly, it makes me feel invisible, and it's frustrating to think that they feel I cannot speak for myself, Just because my body doesn't function the way that theirs does not mean my mind is not functioning.
Points to remember. Speak directly to patient. Stand or sit facing them. Position yourself at their eye level. View adaptive equipment as an extension of the person. In this next scene, Angie demonstrates how to effectively accommodate your patient's physical transfer needs.
Now that we've completed your health history, what I will do is put a notice out for the doctor, and he'll be in just a few minutes.
Okay. Would it be all right if I transferred to the exam table before the doctor got here?
Sure, and how would you like to be transferred? I can get a lift, or...
My personal assistant can help, and we'll do a two-person transfer.
Okay, could you instruct me and Peter how you want to be lifted?
Sure. Pull up close here. I'll have you grab support underneath my upper legs, and Peter will come around behind me and around my back and grab my arms, and then I'll count to 3 and we'll lift up and over onto the table.
Okay, this is an accessible table, so I can lower it a little bit. Would that make your transfer easier?
Yeah, if it's the same level as my seat, that would make the transfer much easier.
Okay, I'll do that.
Much easier. On the count of 3. 1, 2, 3.
Are you comfortable?
Yep. It is always important to ask somebody how they want to be transferred. Some prefer a lift, some slide board, and some like to use their personal assistants. And when asking how someone wants to be transferred, be sure and listen to their instructions. People like to be transferred in different ways. Not using an exam table makes many people with disabilities feel like they're receiving substandard care. I know someone who did not get a full health exam or full skin integrity checked for 5 years because the doctor didn't think it was worth transferring her to an exam table. Accessible tables are recommended as best practices because they are able to adjust in height and are wider and easier for transfers, and should be in every hospital and clinic room. The accessible exam tables that vary in height are not only good for people who need to transfer, but for people who are aging, people who are short in stature, and people with balance impairments as well.
Points to remember. Encourage patients to guide you. Ask patients how they want to be transferred. Have at least one accessible exam table in every clinic. In this scene, Angie will explain why it is important to ask permission before moving a patient's adaptive equipment.
I need to move your wheelchair before the doctor comes in. I'm just going to put it in the hall.
Oh, actually I'd rather you not just put it in the hallway. My personal items like my bag and my wallet are attached.
Oh.
If you do need to move the chair, can we leave the bag here, and then if you would take my chair to my personal assistant in the waiting room? I feel really insecure when someone moves my chair without my permission. If it gets damaged, I'm in a real predicament. Medicaid only covers the cost of a new chair every 5 years, so a repair can be very costly and may take a very long time. It is important to note that people's assistive devices and technology is an extension of themselves, and they get very comfortable and used to a certain brand and specific type of equipment. There are many things that individuals with disabilities cannot access without a letter of medical necessity or prescription. Without that medical documentation, Medicaid would not allow for an order of that product or payment. The doctor needs to be sure to be very specific in being sure to document the brand name and the style and the certain type. Without that brand designation and justification, insurance company will likely provide a less expensive and less quality piece of equipment Therefore, in the instance of my cushion, I would be very concerned of skin breakdowns for me.
Points to remember. Ask permission before moving a patient's equipment. Equipment is expensive and funding source may limit frequency of replacement repair. Encourage patients to guide you on documentation needed to obtain medical equipment. In this demonstration, I will show how technology can assist persons who are blind or visually impaired when setting up appointments and for completing intake information.
May I help you?
Yes, my name is Mike Honick, and I'm calling to schedule a checkup. Are you taking new patients?
Yes, we are.
How do you normally complete patient intakes?
You can just fill out the form when you come in.
Well, I happen to be blind, so I'm going to need some assistance with doing that. And actually, now that I think of it, I'm wondering if you'd be able to email the forms to me, or the form to me, and then I can go ahead and complete it and send it back to you electronically. If you are able to do that, why don't you go ahead and send me the HIPAA form as well, because I know I'll need to sign that, and I'd really like to be able to read it ahead of time. This is looking like it's going to be really a good thing.
I'm glad to help.
Providing the opportunity to complete intake information in advance, either by phone or electronically, is best practice for everyone, not just persons with disabilities. It saves time for the patient, the health provider, and support staff on the day of the appointment, while ensuring patient privacy. In addition, I recommend that you develop a standard protocol for gathering intake information in a confidential manner on the day of the visit for those patients who prefer to provide it in person. Points to remember. Offer forms and written information in accessible formats. Ask patient which accessible method they prefer. Develop standard protocols to help patients complete clinic forms by phone, computer, or in person. In this scene, I will demonstrate the importance of asking patients who are blind how they prefer to be guided.
Mr. Honick?
Yep, that's me.
Oh. I'll show you to where your exam room is.
Okay, just a second. Who are you?
Oh, I'm Ann. I'm sorry. I'm Dr. Johnson's nurse. I'll show you where the room is.
Oh, okay.
Great. If
All
you'll
right,
come
actually,
this
you know
way.
what? If we could just do this a little differently, if I could just take your elbow here and then walk right behind you about a half step. This is called sighted guidance. It's a good little technique.
Great. It is easier for everybody. Do you need additional information, right or left?
Just when we get into the exam room, just to know where the table is would be helpful.
Okay, we're going through a doorway really quick. And the exam room is on our right.
Okay.
And actually, when we walk through the door, the table is on our right.
Oh, all right. Sounds great. I personally prefer to travel using sighted guide in unfamiliar territory, though that's not the case with all people that are blind. Some prefer to navigate with a service animal, while others prefer verbal instruction. The most important thing to remember is to ask the patient's preference. Points to remember. Ask how patient prefers to be guided. Introduce yourself clearly when talking to a person who is blind. Inform patient when you leave. In this scene, I will demonstrate the importance of using TeachBack for developing care plans that are accessible to meet the unique needs of the patient.
Hi, Mike. I brought in your discharge orders.
All right.
With a summary of the medications and changes that you and your doctor discussed.
Okay.
So I have them right here, and I'll hand them to you, and you can have your case manager or your support worker read them to you when you get home.
Well, you know, actually, I don't have a case manager support staff, so I'm going to need to work with you to be able to access this information.
Okay, well, actually, do you have anything that you can write the information down on?
I have this little device here called the Braille Note. It functions like a Braille laptop, and this is a little display right here, and as I type, the Braille will just appear as I tap on these 6 keys. So I already anticipated that there would be something I'd need to write down, so I've got a file open here and I'm ready to write.
Okay, well, I will read the doctor's orders to you.
All
And after I'm done, I typically ask people to read it back to me.
Okay. Okay, got it.
Could you repeat those back for me?
Sure. You want me to take 10 milligrams of omeprazole daily for my acid reflux and 10 milligrams daily of lisinopril for my high blood pressure.
Perfect. There's only one other thing that the doctor wants to do is he wants you to monitor your blood pressure every day. Typically, we would prescribe a blood pressure cuff and have people take it at home and then report to us.
Okay.
However, I don't know if there's a device out there that's accessible for somebody that's blind. So could you tell me how you would build that monitoring into your daily schedule?
Yeah, actually, I think for the short term, I happen to work in a facility where I would have direct access to healthcare providers. And then for the long term, there are companies out there actually that make talking blood pressure cuffs. So I'll start doing some research.
Great. Well, it sounds like you have a plan in place.
During the discharge portion of the previous patient encounter, Anne asked me to read back to her the dosages of 2 medications which the doctor prescribed. In doing so, she utilized a very useful technique which is commonly known as teach-back. Employing teach-back allows the healthcare provider to confirm that the patient understands instructions while encouraging the patient to ask questions. Assistive technology, or AT, is an excellent tool for facilitating communication and enhancing health literacy for patients with disabilities. Options range from specialized technologies, which you viewed during the previous patient encounter, to common off-the-shelf devices such as iPads. Clinicians such as speech pathologists and physical and occupational therapists, disability service organizations, and, most importantly, your patients with disabilities are excellent information sources on assistive technology. Points to remember. Develop accessible discharge plans. Ask if the patient uses technology to help them access written materials. Use teach-back to confirm how patient will implement recommendations. In this demonstration, Sylvia will describe how to develop a communication plan with patients who are deaf or hard of hearing. The voice you will hear is that of her interpreter.
Healthcare providers should always develop a communication plan with patients who are deaf or hard of hearing in advance. I can tell you from personal experience that this process will not only assist with communication but also make the patient feel more relaxed and provide reliable test results. Persons who are deaf or hard of hearing communicate in many different ways. You will make communication go much more smoothly if you ask which method the patient prefers: sign language interpreter, lip reading, or writing on your admission form. If your technology allows, use the information on the intake form to pre-arrange accommodations. A general rule for interpreters is to arrive 15 minutes before the assignment. In addition to providing communication assistance, the presence of an interpreter can be reassuring to patients and help reduce anxiety if they do not understand office routines. American Sign Language and Signed English have 2 entirely different structures. Therefore, it is important to make sure that your deaf patients understand written instructions. Be aware that some deaf individuals may ask the sign language interpreter for assistance with written material, which is another very good reason to comply with requests that an interpreter be present. Never ask family members to as interpreters, especially children, but do honor the patient's request if they wish to select a family member. Video remote interpreting, or VRI, is a good option for emergency situations. VRI is a service which uses devices such as web cameras or video phones to provide sign language interpreting. If an interpreter is delayed, or if there's an emergency situation, it may help for you to know some basic signs to help direct your patients during an exam. Stand up, sit down, lie down, breathe in, hold your breath, wait, roll to the left or to the right, finished, thank you. I suggest that you post pictures of these signs on the wall in the exam rooms for reference. If the person is hard of hearing, he or she may read lips. Sit facing the person and do not cover your mouth. Speak in a normal tone and speed. Do not exaggerate your lips. If a patient has a difficult time understanding a word, write the word down or try a different word with the same meaning.
Points to remember. Ask which communication method the person prefers. Assure your clinic has intake information that alerts you to the need for an interpreter. In emergencies, use video remote interpreting VRI services. Learn a few common signs needed for procedures done in an emergency or while waiting for an interpreter. In the next demonstration, Tyler will show how to work with a patient whose speech is difficult to understand.
Hi, I'm Ann. I'm Dr. Miller's nurse today.
Oh, hi, it's good to meet you.
And I'm wondering, did you bring your guardian with you today, Tyler?
I actually don't have a guardian.
Oh, well, that's good to know.
Yep.
Then we can go ahead and begin. The very first thing we need to do is to have you fill out this health history form. So I'm going to leave it with you, and I'll be right back.
Actually, I have a hard time writing, so would you mind helping me out with that?
Oh, not a problem. We'll fill it out together. So the very first question we have is, will you tell me about your physical conditions?
Sure. I was born with...
Cerebral palsy?
Yeah, actually, I know that you guys are in a hurry here, but, I would kind of appreciate it if you can finish my sentences. Sometimes it just takes a little bit longer for me to say some things.
We know you have cerebral palsy. Can you tell me if there's additional physical conditions or concerns?
Over the past 2 months, I've been feeling kind of depressed, and I wanted to know, is that normal?
Mm-hmm.
Did you understand that?
Well, actually, I didn't quite understand what was happening over the last 2 months.
Yeah, I've been feeling kind of depressed over the past 2 months.
Okay, so feeling depressed for 2 months, you're wondering if that was normal?
Yeah.
Okay, actually, the doctor will really want to know that and talk with you about that, so I'll make a note.
Okay.
All right. And can you tell me now what you do to keep yourself healthy?
I do karate.
What was that?
Karate.
Boy, I seem to be struggling. Can you tell me again?
Yeah.
Oh,
Karate. Yeah.
that does keep you active.
Yeah, it does.
All right. And do you have any other questions or concerns that you would want to talk to the doctor about?
Yeah, my girlfriend and I are getting very intimate, and I was wondering if what the options were for contraception or things like that.
Okay, I understood something about you and your girlfriend, but can you think of another way to tell me what your question is?
Safe sex.
Oh, you'd like to understand about methods you can use for safe sex. Mm-hmm. Great. I will write that down as another thing the doctor can talk with you about. And I believe that we're finished with the health history.
And there's a lot of good communication techniques. She asked me to use different words. She asked me to repeat things. And she asked me to demonstrate what I was trying to say through actions. You can also do things such as ask yes or no questions, or use a fill in the blank to effectively communicate. A speech impairment does not mean that someone has a cognitive impairment. Understanding comes with contact. Persons with disabilities have full lives and want to experience friendship and love just like everyone else. Some people with disabilities may have someone such as a parent who is a court-appointed legal guardian or their power of attorney. Those are the only times where you're allowed to share information without the patient's consent. Otherwise, the information is protected under the HIPAA laws. If the patient does have a legal guardian, you must get permission from the legal guardian before treating the patient. However, having a guardian does not undermine anyone's right to have a private conversation or get information from anyone, including health care providers. If the patient gives consent, assure that family members and support staff are given the necessary information.
Points to remember. Ask patients to repeat what they said. Use different words to clarify meaning. Have patients answer yes or no questions. Ask patients to show you what they mean or write it down if speech is not clear. Many disabilities are not visible but still require accommodations. In our final discussion, Abby and I will talk about the importance of recognizing the presence of hidden disabilities that may impact an individual's ability to access health care.
Many people have hidden disabilities. Some people have learning disabilities, severe asthma, cardiac issues, traumatic brain injury, and even my cancer. My cancer was an invisible type of disability until it came to where I needed to have my amputation.
Other disabilities that may not be easily visible include mental illness, intellectual disability, and autism. Some patients who experience learning disabilities, a traumatic brain injury, mental illness, intellectual disability, or autism may find it difficult to understand, read, or process the information contained in standard treatment plans. Many of these patients may not be comfortable disclosing that they need help in explaining their health problems or understanding instructions. However, you can learn a great deal about the preferred learning style of each patient through close observation and direct questioning. Remember, too, to avoid wearing perfumes or colognes or using cleaning products that may contribute to headaches or breathing problems in sensitive patients. Points to remember. Ask patients how they learn new things best. Use teach-back methods to assess patients' comprehension of instruction. Assure written materials meet health literacy standards. Confirm if patient needs assistance with reading written instructions. Those of us with disabilities want you to know that our disability is simply a fact of life. It is neither a focal point nor a point to be ignored. A disability is part of who we are. When working with persons with disabilities, it is important to treat them with respect. Treat adults as adults, even when they have intellectual disabilities. Assume I can do things with or without supports instead of believing I can't do something. Make decisions with me, not for me. Help me see my opportunities instead of limiting my choices. As my colleagues and I have shown you, a disability can make it harder to access health care, but you can help us overcome many of the barriers to quality care. Specifically, you can speak to the person, not about the person. Accommodate each person's personal property and special needs. Listen actively and share information in ways that are easy to understand. Above all, respect the questions, concerns, and hopes of all patients. For more information about communicating with people with disabilities, please refer to the resources listed at the end of this video. Thank you for your time and interest.